What's going on, guys? It's Flynn. Do a transition update. So today's Monday, the 27th. I got a surgery coming up this coming Friday. I just celebrated 3 years last Monday on T and had a big party. It was a good time. I'm glad everybody showed up to support and celebrate, so that was fun. So a little pre-op stuff. Had my pre-op last Monday, actually, and I first met with the OB doctor, who kind of told me that, you know, they're going to go first when it comes time to starting surgery on Friday. I got to be there at 6:30 a.m. They'll wheel me back around 8:30, and then get started after that. Their part won't probably start until, she said, around maybe 9:30. And then their portion will take about an hour and a half. And they're basically going to go in through the abdomen for cameras and then pull everything out. Oophorectomy, full hysterectomy. So they're going to take out the ovaries, the whole uterus, everything, basically. And their part should take around about an hour or so, maybe an hour and a half, she said. At that point, then the other surgeons will come in. My main plastic surgery surgeon, Dr. Poe, she'll come in and start dissecting my junk down there, and I would assume probably get it ready for the urologist. They'll come in and they're going to take a graft from the inside of my cheek to do the lengthening of my urethra. They'll more than likely, or they are going to probably remove a section of the upper pubic area just to put it in position of what the cis male genitalia is, because female genitalia is kind of underneath, and so they'll pull it up so that it's more in front, and then create a scrotum. They're going to create my new phallus, and they're all just using this first surgery is just using what I got currently. They're not taking the graft yet for my arm. That's the second stage. I still have to finish up electrolysis on my arm to get all the hair removed. So just this surgery alone, they're kind of creating the frame, so to speak, before the next big one. So the other surgeon's portion, give or take, may take around 4 to 6 hours. So all in all, I'll probably be in there for at least 6, maybe longer. And then I'll be in recovery for anywhere from 2 to 3 hours, they said, depending on how I do and come out of anesthesia. Usually anesthesia hits me pretty hard. I'm kind of a lightweight, and so they tend to give me a lot, and it takes a minute for me to come out of it. For me, I also get usually very, very sick, like vomiting sick. And we've kind of, in the last couple surgeries, found the right cocktail for me to take, which is I'll take like a kind of like a Dramamine prior to surgery. They'll give me Versed, which side effects are for nausea. I also have been taking, or in the past surgeries, they've given me Amend, which is like an anti-nausea for patients who are going through chemo. And I'm pretty sure that that's really the thing that's been the most helpful. I'm coming out of anesthesia more alert. Normally I'm so out of it and groggy, and I don't remember a thing usually. But definitely I think that Amend has really done the biggest thing for me. And like I said, the last 2 surgeries I've had, I've not gotten sick once, thank God. Still a little loopy and out of it, but more alert and definitely not sick. And they really don't want me sick because I'm going to have a lot of stitches in the abdomen area. I'm going to have a suprapubic catheter coming out of my belly button. Stitches all the way up from my butt to the front to stitch it all up. So yeah, so they don't really want me violently vomiting or anything like that. So hopefully that'll be the case. This will be the first surgery that I've been put under for over 3 hours. So it's a longer, more invasive surgery, obviously. But I'm hoping, from past experiences, that the sick part, anyway, won't be there. I am a little nervous for the recovery portion. I don't really know what to expect or anticipate. I've heard great things, and then I've heard some really not great things with this first stage. All my doctors and nurses seem to think within the first 3 or 4 days I'm going to be feeling pretty good and really not in so much pain. But I'm kind of expecting the worst, I guess, just to prepare myself mentally. So anyway, they definitely want me up and moving day one. Not a lot, but they want me walking, which will be a little difficult. They advised that if I had a wheelchair, or not a wheelchair, a walker, that will definitely help just with strength and stuff like that, and just helping me move a little bit. They want the blood flow because they don't want anything to die, essentially, or get bed sores, that kind of thing. So they want me up and walking at least an hour a day for the first week, and then gradually up it after that. And I'll continue to have the catheter all the way through, I believe, the 21st of June. I don't have a post-op appointment until the 17th, and I can't shower until then, which is going to be a little rough. So they got some pretty specific instructions as far as prepping for surgery. So as of Monday, they told me no more shaving anywhere down there. They're going to do it, and they want to see, I guess, how the hair grows, and I don't know if that matters on stitches or where they place certain scars. I don't know. So they said absolutely no shaving. The night before, they want me to wash from the neck down with this special soap. Clean sheets, clean towels every single time. And then even morning of, they want me to shower again. Same thing with this special soap. Just rinse it off and leave it. And then they also want me to drink some kind of Sprite or light Gatorade, ginger ale, something prior to surgery for the sugar portion. I'm gonna stay in town for around 3 days or so after surgery. We're gonna go into LA on Thursday night and stay until Monday, unless for whatever reason I feel good and I want to come home before that. But I wanted to be close just on the off chance that there might be complications or anything. I want to be close to the hospital over there and my surgeons. Being in San Diego, it's, an easy 3-hour drive with traffic. So I didn't want to risk it. So we're going to stay out there for a few days and then kind of see how it goes and come home after that. I'll have to go upstairs when I get home. But once I'm upstairs, I'll probably just stay upstairs for a while. I can walk around up there to get my steps in, but otherwise than that, that's kind of it for the updates. I'll try and do an update every day post-surgery. And if I can't do an update, I'll have Nina do an update, especially day one coming out of surgery or something. I'm sure I'll be sleeping, so I'll have her kind of update. And I will do an update actually before I head into the operating room. Just kind of get, where I'm at emotionally, physically, that sort of thing. So, stay tuned.